So I'm going to break it down into really simple things. Hepatitis is just inflammation of the liver. Now we know hepatitis exists and children do get hepatitis for various reasons. There are viruses that cause it. So there's A to E, so A, B, C, D, E, and they all have their different variations in how they represent in children. And then we also know that there are underlying genetic conditions that can cause hepatitis. And if we look at older adults, alcohol and some certain drugs can also cause hepatitis. So it's an inflammation of the liver. What happens is the signs that that presents to the person is that you can get yellowing skin or yellowing of the eyes. You might get itchy skin as well. Your child might have dark urine and pale stools. They might complain of cramps or lots of fatigue. They might also complain of loss of appetite as well. And they might get these spiking temperatures, which we can't seem to get under grips with.
Okay, I know this looks like a lot, but I promise it's really simple. Both A and E are similar. D only occurs in the presence of B, and C is the outlier. First off, all of the symptoms will be the same for each virus, and each of the diagnostic tests will determine an active or previous infection. Then all of these diagnostic tests have similar names, alternating A through E, A, B, C, D, and E. So for treatment, anything that is acute does not need medications and will recover on its own with supportive care. Anything that is chronic will need antiviral or interferon medications. So A and E are acute viruses, so no treatment is needed, and they're both transmitted through fecal oral route like contaminated food and water. The only difference here is the childhood vaccine for Hep A, and then for Hep E, there is no vaccine, but we can cook our meat thoroughly and drink bottled water. Hep D only will occur in the presence of B, so we call them best buds. Both of these can be acute or chronic and transmitted through the three Bs: body fluids, blood, and birth. Because they are best buds, a vaccine for Hep B will also prevent Hep D. And last, we have Hep C, which can be acute or chronic, and the most common transmission is IV drug use. There's no vaccine for Hep C, but we can give antivirals, and a big tip for nurses, we're washing our hands thoroughly, we're using proper protection, and we are watching the sharp needles.
Hepatitis C is an RNA virus. It's transmitted through the blood. You can get it from sharing needles. You can also get it through delivery after a woman is pregnant, and you can get it rarely through sexual contact. It can cause liver cirrhosis, which is scarring of the liver, and long term that can lead to liver cancer. Screening for hepatitis C is now recommended by CDC for all people ages 18 and above. Hepatitis C used to be called the silent killer. That's because over time, you wouldn't have symptoms until it was possibly too late. And nowadays, when we screen everybody, we can catch it early, we can treat it shortly, and we can get rid of it for your entire life.